Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Hello, and welcome to the Empower Hour with Greater Nashua Mental Health. I'm Dr. Cynthia Whitaker, and I have the privilege of being the CEO at Greater Nashua Mental Health. We have this program on often so that you can learn about the things that we do, the things that happen in our community, and all types of information that can help you and our community to be empowered. My guests today are Sue Durkin and Greg White, who are the co-CEOs of Lamprey Healthcare. And I'm so excited to be able to talk to them today about all the things that they do and the partnerships that they have throughout our community. Welcome to the show, Sue and Greg.
Thank you.
Thanks for having us.
So I'd love to just start with, what is Lamprey Healthcare? What do you do? And
Sure. Lamprey Healthcare is a federally qualified health center. So we exist in Nashua, Newmarket, and Raymond, New Hampshire. By design, we exist to serve those who may find access to care difficult, primarily around primary care, if you want to expand on that.
Yeah, and we have integrated services. So we have behavioral health integrated into primary care, care coordination, diabetes education, and a whole host of services all under one roof.
so by definition, a federally qualified health center or community health centers, as kind of they're collectively known, offer kind of a wide array of services that take into account more than sort of just what somebody might think of with primary care. So a lot of those things you just mentioned.
Very much so, yes. And in many cases, you'll see health centers that offer dental services or pharmacy services. We also do some job training work in terms of nurse practitioner fellowship and medical assistant apprenticeship. We're also the host organization for the Southern New Hampshire Area Health Education Center and the Seacoast Public Health Network.
So a lot of different things.
Lots going on,
at
yes.
Lamprey.
And we do rely on partners for some of that. So like over the past year, we've really focused on dental care, but knowing that we don't really have the expertise to do it ourselves. So we partnered with Greater Nashua Dental Connection for that and Solvair Dental. So they come on site. The Dental Connection actually comes right into our location and provides hygiene and screenings for well child and adults with cardiac risk.
Wow.
Yeah.
And other partnerships exist, like
Yes.
with community
we
mental
do.
health centers. So we have an integrated health program. Like, I'd love to hear your thoughts on it, and then I'll share some of mine.
Are we
too.
in year 6 or 7 now?
Yeah, I've lost track.
A number of
thankfully.
years
Yes.
ago, before the pandemic, we actually partnered with Greater Nashua Mental Health and brought primary care into the building at Greater Nashua's main facility on Prospect Street. In doing that, we're bringing care to patients that might not otherwise come see us or might not otherwise access primary care. And I think between the two organizations, we've worked out a very good partnership where we're meeting the patient's needs in the best location possible. And so you can speak to kind of the health outcomes that we've achieved.
Yeah, it's a real, as you know, Cynthia, a real high-risk group that needs a lot of support. So they may not be keeping up with all of their preventative health requirements. And, they also may have had some prior bad experiences with healthcare. The healthcare system's not easy to navigate for people with a lot of resources, a lot of support. So we kind of designed this program to really literally and figuratively meet them where they're at.
Yeah.
And just try to partner with the team that they already know and trust and deliver services through that. And that has been really incredible, especially looking at patients with chronic health conditions, which a lot of patients with mental health issues may be on meds that put them at risk for things like diabetes or high cholesterol. And we're able to address those in a setting that they're comfortable in.
Yeah, one of the stories I often tell is we partnered before your times,
Yes.
but not my time, because
Yes.
I've been in this community a long time now, back with SAMHSA for a pilot program moons ago with Lamprey to do integrated health where you all were with us. And then we lost funding for a number of years and had about a 3-year absence before we restarted the program, rebranded it as Integrate Health. And there were a few clients, not too many, but a few, who despite the mental health center's best effort to get them connected to primary care in that 3-year window were not receiving primary care services. And it was because of some of the things you mentioned, like just not having a good experience or not feeling comfortable for whatever reason, even though our staff were really supportive in trying to get them connected. And to see those people now, have 6 years again of good primary care results in some real positive health outcomes for folks.
Right. And a lot is building relationships and building trust with people. We always say with a lot of our off-site programs, in addition to what we're doing with you, we also have a mobile health unit,
Right.
And we partner with Nashua Soup Kitchen and Shelter. And we really focus those teams on thinking about healthcare really through like the lens of engagement. So really thinking, our success today might be that person comes back, or that person thinks about coming back. It's not necessarily going through the checklist of, oh, you have, this condition and you need all these things, because it's too overwhelming for people sometimes. So we really try to gauge that, and I know that your team has been really helpful with us.
Yeah. So tell me about the partnership with the Soup Kitchen. So what does that look like for our community?
Go ahead.
Yeah, that is really exciting. So we started first by bringing our mobile health unit over to their Quincy Street location. And we quickly saw the need was huge. So for individuals to access our mobile health unit, they just walk up for care. And we staff it with a medical provider, a nurse, and a community health worker. So if patients have insurance or they don't have insurance, they have any kind of questions, we can help them in the moment, which is really nice. So the need was pretty intense. We would have people lined up for services. So then we decided to build on that, and we received some funding to outfit an exam room at their Quincy Street location. So that has worked out great. We're there 4 mornings a week, and both being at their Quincy Street location and Spring Street allows continuity. So we may see someone on our mobile health unit who really needs a physical exam. And before, we would try to convince them to come on site to our main location at Prospect Street. Now we can just say, well, we'll meet you over at the exam room and we can finish over there. So it's really helped with continuity.
Yeah, that's fantastic. Of course, when you said you got funding for, my brain went to the context we're recording in right now is, of course, spring of 2025, where there's a lot of uncertainties for funding. And I think that leaves people afraid or having thoughts about they can't access care. So what would you like to say about kind of that context we're in right now?
I would say that we are open for business. We've not
Yes.
changed anything that we're doing. You are welcome to come see us in any of our locations. And we're here for the community. We're here for folks to access care. If folks lose insurance, that's why we exist.
Right.
So we're endeavoring to maintain that, and we've not made any changes. So.
Yeah, I that's one of the same commitment we're making as a community mental health center. I think there's a lot of parallels between community mental health centers and community health centers or
Very much.
FQHCs. And same message for us. Like, we're trying to navigate what's happening around us, but we want those people that need us to still come to see us.
Right.
Exactly. And I think one of the points we'd like to make too about our integrated work, particularly with your organization, is health outcomes for people are improving because of that work.
Right.
And it's better for the individual in terms of their well-being, but for those that are in the public realm in terms of how we're funded, the outcome is better, meaning they're not visiting the emergency department as frequently, or their chronic disease is managed and they're not having a negative outcome. So I think that's a point we'd really like to make, is that it's best for the patient in many ways.
Yeah, I mean, I can think of a number of examples from, again, our integrated program where having you all on site allows the psychiatrist or nurse practitioner who might get a question from a patient about their medication. Is this symptom I'm having a side effect of the med that they're prescribing for the psychiatric condition, or is it something else? And to have you right there, we can get those questions answered in real time for patients we share, which again leads to more timely answers and potentially better outcomes because somebody didn't delay something thinking it was something when it was really something else.
Right.
Having the whole team there to consult and huddle at the end of the day, I think is a wonderful, wonderful utility and helps that process tremendously.
Yeah.
Yeah, and everyone has a different perspective or knows a little something and has something to add. And I think it's when you have that integrated approach, you just, as you said, you get the best health outcomes, really.
Yeah.
And then patients also feel like there's a team supporting them, like rooting for them, you know, and that is really important too.
Yeah, I think one of the other things that community mental health centers and FQHCs share that a lot of folks don't understand is that we do a lot of things outside of what I would say the office, or what you might say the exam room, right? That it's not just about a person coming to an office for therapy or a person coming to an exam room to be treated by a doctor or physician. There's a lot more that we do. So when you say you address things outside of the exam room, what does that mean to you?
Well, I think it's thinking about, you know, where they live, all the social context that exists. It's thinking about, you know, how are they managing things? You know, if you have a patient who is just diagnosed with diabetes and they need insulin, how do you know they have a refrigerator to store it? You know, it's thinking about all those pieces and trying to incorporate that into a plan. We recently, one of the programs we recently started, you know, really to support this thinking is remote patient monitoring and chronic care management. And that has been great because the focus is really trying to support patients to take care of their health on their own. And that's really the goal we're working towards. So we're able to, you know, patients who have chronic health conditions, we're able to set them up with scales or pulse oximeters or blood pressure monitors, and then they'll have a nurse check in with them at least monthly, many times more than that. And then that information is then fed into our electronic medical record, where our medical providers have all this information to review that just helps with better decision making and helps with a plan that's really individualized for the patient.
We also have staff dedicated to assisting folks with enrollment in programs and to screening for eligibility, so that, again, even folks with a lot of resources find the system difficult to navigate. So in terms of whether it's enrollment in Medicaid or other state programs, or navigating an application process for housing or things like that, just making sure people are aware of where benefits might be available and helping them work through the process. So whether it's our application assistance counselors, our community health workers, or care coordinators, basically helping to navigate a very complicated system.
Right, so not just sitting in an exam room saying, call this person, monitor this, do this, because when we do that, there's an assumption somebody can navigate it on their own, or has the tools to navigate it on their own. And so it sounds like your team really does a lot of inquiry to make sure somebody can navigate the things that they need to support their health.
And we've just started some new programming with the help of the state to help patients who might be at risk of a cardiac issue. And so we're helping them connect with community programs, whether it's Weight Watchers or the Y and yoga. and just helping them take steps to like improve their lifestyle that then will improve their health as well.
Right. So again, not just a referral, you should join the Y, you
Right.
should do this, and assuming the person has the means or the resources.
Exactly.
Yeah.
Right.
Yeah, the parallel to me is like when people often give food pantries lots of mac and cheese, but forgetting that in order to make a box of mac and cheese, you need milk and butter.
Exactly.
But nobody donates the milk and
Right.
butter.
Exactly.
Right? It's kind of the same thing if we say, "Oh, go to the gym," but we never ask, "Can you afford it? Do you have a membership?
Right.
Do you have transportation to get
Transportation to get there, yeah.
Sneakers.
Do you have sneakers?"
Yeah.
Right. Yeah,
Yeah.
exactly.
Yes, it's thinking about all those little pieces that can trip you up, you know, and we're lucky. We have very integrated services, but a lot of partnerships. You know, we have the United Way Food Pantry that comes over. So again, thinking about food insecurity is really foundational as
Yeah.
well.
Right.
Yeah, I love all of the examples because I mean, to me, it's one of our core values is being collaborative,
Right.
right? And I think it truly is what helps people thrive in our community.
Yes,
Like if we tried to be the only provider, or if you tried to be the only provider, and didn't collaborate with folks like the Soup Kitchen, Dental Connections, United Way, Y, all of our fabulous partners, we ultimately would be doing a disservice.
Absolutely.
Gets us away from the siloed system, I think, that healthcare tends to exist in. And I think, we are a community organization first and foremost, and we work with the community.
Right.
So,
And they're all interconnected. You know, someone's physical health is totally interconnected with their mental health, with their dental care, with their housing status. So to really not work together, just as you said, is not helpful to the patients.
Right. It takes that idea of a whole person's health, their
Right.
whole circumstance
Yes.
is part of how we get to our health.
Right.
Exactly.
Right? Like our well-being is not just
health, big H.
right.
Exactly.
Like you said, it's not the checklist.
Yes.
Right? It
Right.
can feel like the checklist, but it's not.
Right.
Right?
Exactly.
And small things can add up to big things.
That is such a good point. Absolutely.
Because I think people forget that sometimes when we think about mental health or physical health, they're looking for that big gigantic change. Well, this didn't help me. Well, but it helped you a little, and if those little helps will add up over time.
Build on it.
And
Yes.
it's the baby steps. And it's, as I mentioned earlier, just having that team around you that you feel are in your corner, and acknowledging and helping you see the progress. That's where you see it work for people.
Right. Do you think, like, on our end, I think when you say that, I think about a lot of how when people come to us, they don't have hope to get better, and how a lot of our job is giving people that hope that they will get better. Does that often happen in your context too? Like, I'm thinking about especially if somebody's uninsured and maybe they've neglected preventative care and then they're coming to you. Like, is that part of the work you end up doing as well?
Very much so,
Definitely.
yes.
Yeah.
Yes, definitely. And I think some of our programs in particular have, I've just heard through staff have been so rewarding for them. For example, we have an MAT program, and I believe you do as well.
So medication-assisted
Yes.
therapy for folks who with substance use disorders.
Yes.
Yeah.
And, a lot of these patients have, they come into us and they're not feeling very hopeful.
Yeah.
And the people around them are not feeling very hopeful. And that's part of our job, is to really, help give them the tools, offer that encouragement, recognize those baby steps that are helping to move them in the right direction.
We have a story about a gentleman who first accessed our care through the mobile health unit in a community outside of Nashua, unstably housed, had some things he was working through. And his first contact with us was through the mobile health unit and the community health worker. He's been seeing us for 4 years now, is coming down to Nashua to the Y, I think every day. He's lost a lot of weight. He is in recovery. It's one of those situations where I don't know if he would have progressed in another way, but in terms of his willingness to share that story with us and to allow us to share it publicly, tells me we've restored something there. It just makes you like, wow, this is why we do this.
Yeah.
Right.
So,
Well, and I think that's why you feel and I feel that like important message of, and we're available. Please don't think
Yes.
we're not,
Yes.
because we want to hold that hope for people. And and if somebody does come and we're not the right fit, we'll do whatever we can to get them to
Right.
where it is.
Right.
But we want people to reach out for
Right.
help,
very much so.
no matter what.
Yeah, and that was part of why we really focused on kind of some of our off-site programs, because as a community health center, we're focusing on the whole community and not just people who can schedule an appointment, come in our doors, pay with an insurance card. We want to help people get to that point if that's kind of what works for them. But we really thought, especially during COVID, there's a lot of need that's not making it in to us for us to make a difference. So that's really when we looked on, who could we partner with? And again, you all have been amazing partners to us, and we bring our van to one of your locations. We have a number of partners, Nashua Soup Kitchen and Shelter, Milford Share in this region. And it's really helped us, just kind of say to people, it's okay to ask for help, and
So let's go back, because I think another thing that sometimes people don't understand is we've talked a lot about the scope of the services, right? In the exam room, outside of the exam room, in the community, but also what ages you serve. I think sometimes people think it's only one thing, not the other, and how many people, like in your system, you actually provide care to.
yeah.
So we serve everyone.
Everyone,
So
right? Exactly.
newborns to our silver seniors. No limits there. We actually have an OB program where we actually deliver babies. We have internists, family medicine, pediatricians.
Yeah, I think people don't realize you have all those specialties within your center. Sometimes people think those only exist in bigger systems, but
One thing I'd like to emphasize too is that by our own mission, we serve everyone without regard to their ability to pay. So sometimes there's a perception of, oh, you have to go to the health center if you have no insurance, or we only take folks with no insurance. That's not true. We're contracted with Anthem and Harvard and all the other payers. We have resources in place to accommodate folks who perhaps don't have insurance or are underinsured or have Medicaid. It doesn't matter to us. It's, you're welcome.
right, you literally will serve anyone.
Yes.
Exactly.
Yeah.
Exactly. And we also serve, a number of people who speak different languages. So we have interpreters that are on staff, and then we also have language lines. And, I think you had mentioned earlier, we really try to bend to accommodate people. We just don't feel like everybody needs to fit into a box. When you think about it, almost nobody fits into a box.
Right, exactly.
So we try to, adapt ourselves to the need we see in the community and also to the person who's in front of us.
Yeah, in our world, we call it person-centered care.
Yes.
Yes.
Right. That
Yes.
it's really about the person showing up rather than an if this, then this kind of, calculation or whatever to figure out what you need. I mean, granted, relying on the research is important, and we want to do things that are in line with evidence and things.
Right.
But we want to treat each person as
Exactly.
the individual they are.
Right.
But I think people don't realize that our FQHCs, community mental health centers, right, all have that wide range of
very much
services. So important.
Foundation to the community, I think.
Yes.
Yeah, I would agree with that. I think at the event we were all at on Thursday last week, somebody used the example of a fishing net, and we are the netting, the safety net for our community.
Right.
But yet we need the structure of the wood to hold the net, which is, how we get paid, or the Medicaid system, or our community partners, I think, are part of that structure that helps us
very much so.
be the safety net. Yeah, I loved that analogy.
Yeah, yeah, it's great. And the other thing you had asked about how many are we serving? We're at about 17,000 patients. So it's, it's big. There's a lot of people out there who need support and help. But we also serve people who, it's the whole range. It's a snapshot of the whole community. So we also serve people who are very well insured, who are leading, very professional lives. And it's that whole mix that really adds value, I think.
Primary care.
Primary care, right? I mean, 'cause
exactly.
everybody needs primary care,
Right.
so everybody's accepted
Right.
for primary care, right? Yeah, that's really great. And are there any other myths that we should be dispelling? Because those are the big ones that popped into my head,
Sure.
but you certainly know them more than I do.
One of the ones that I think is important to dispel is that you're getting, just because you may not have to pay for the care, and we're serving people regardless of the ability to pay, that you're getting substandard care.
Yeah.
And in many ways, I think it's quite the opposite.
Great.
We're very regulated. We do a lot of reporting, and we have to abide by evidence-based standards of care, and we track outcomes very closely. So, we have it's like a source of pride for us, so I'll share it. We have received awards nationally for being in the top 20% of health centers for health outcomes.
That's awesome.
Which is amazing. And that really speaks to our team working together and kind of, collaboratively. But we also, because we're an FQHC and have capabilities around reporting, we can look at trends that we're seeing across populations. So, for example, our patients with high blood pressure, we can look at all of them and look at trends like, are they running out of medication early? Are they seeing delays with refills? Why are they not as controlled as we would want them to be? Or our patients with diabetes, we can look at these trends within the population and say, wow, we're getting a lot of cancellations on Monday mornings. Maybe we want to start changing our schedule to adapt to this population. So that's another really exciting thing to see.
Yeah, and I think that's, again, so many similarities with the community mental health and the community health systems. Like, I think a lot have think, they're not as qualified.
We have real doctors.
Yeah,
Yes.
right. We have real doctors.
Exactly.
We have licensed therapists.
Right.
And we also have auxiliary staff like case managers, care coordinators,
support.
community health workers, peer support specialists that other systems don't have,
Right.
which come alongside and support that care, which
Yes.
makes it better and provides those better outcomes that we're talking about.
Right.
Yeah, those are the wraparound services that we're very proud of.
Yeah.
So,
Exactly. And I love hearing like nationally too, like, because I do think people think, New Hampshire,
Right. Right.
Or we're not funded well here, or
And we're behind the times.
or we're behind the times, and that's really not true.
And it's such a good point that you say that, because we get federal funding, we do have access to resources where we're able to stay on top of what's happening, and benchmark ourselves against other places across the country.
Yeah,
I
I feel like I'm learning more about your world as we bring certified community behavioral health clinics online, which are federally approved community mental health centers. And this year is kind of the first year for that in our state, and learning about, like getting assistance from people all across the country.
Yep.
Again, just makes us better providers, right? Because
really
you're
does.
learning about what's happening.
A lot of ideas.
A lot of
shared.
ideas.
Yes.
Yeah. Or somebody else has a successful program and you can say, okay, what can we learn? What can we adapt for our community
It's
here?
very exciting.
Yeah. It's definitely a good model for learning, co-learning, and elevating each of us.
We actually learned quite a bit working with your organization. So, you've assisted us with our internal integrated behavioral health care in terms of, being able to implement that and being able to have some consultative support from your team, and I think it's worked wonderfully for in both directions.
Right.
So.
Yeah, and I mean, I think that's true too. Like we're saying, like we're not providers on an island, right? We're working together to create that continuum of care for everybody.
Right.
So some people have high mental health needs, and so them getting their physical health care with us, integrated through you, makes good sense. But other folks, their behavioral health needs are better addressed as part of their primary care with you. But then if you get into a sticky situation, right, we've got your back.
Exactly. We can reach out to you.
Yeah, I mean, it creates that, and it doesn't overtax either system that way either.
Right.
Exactly. We've broken that silo. So.
Right.
Yeah, and I think that partnership between community mental health centers and community health centers happens all across the country.
Right.
We're just kind of getting to it here.
Yes. Yes.
I think we've been at it with your organization for a bit, and it's
10,
gone
15
well.
years, something like that. And you're doing the same thing out in the other regions.
In
with
Derry.
Derry,
yep.
Exactly.
With the other community mental health center. So I think, it works. It just works.
It does.
Exactly.
And I just the stories of our, kind of the success stories that we hear, it just, you hear them and you see them at the huddle meetings, and it's just like, oh my word, it's just kind of amazing. I have a finance background. I'm not a clinical, but having watched a few of these, it's like, wow, we've got a lot of people in this meeting today. But the problems that got solved, and when I say problems, it's really logistics. But this specialist understands the patient's living condition. This specialist understands kind of their physical health and your mental health treatment, and everybody's there, and we've got things resolved that might take weeks otherwise to chase a email or a fax
or pulling together resources. So we were talking about somebody doesn't have a scale at home, but the doctor would like them to monitor their weight. What do we do?
Right.
Well, if we huddle together, who has the resource that can help this client quickest?
Exactly.
Right. And maybe it's us, maybe it's you. Depends on which program they might qualify for. Right. Like that huddle allows us
makes it happen.
Yeah.
Right. It makes it happen.
And it supports patients being engaged in their care, because we can all attest to it. It's so frustrating if you're trying to navigate the health system on your own, and the amount of time that it takes to get from A to B, and then you're waiting to get into a specialist. So it just it does wonders, I think, on many levels.
Yep.
And I love that we've had a couple success stories smattered in along the way here. And, some we share, some that really, I think, have been the result of that outreach you've done in the community.
There's ones that land in your heart too. So it's, particularly if, in your own community, and that it means something to us to be able to do that. But it's such a positive outcome for an individual that might not have otherwise had that opportunity. So.
It really kind of points out for me that power of community, of collective, and even if the success was because they connected with the team in your van or had that great relationship with a community health worker, they wouldn't have gotten that opportunity if the partner hadn't allowed your van to be parked there.
If we had,
100%.
The timing of us working together at the right time, at the right place, I think is a big key to this.
Right, or if somebody didn't just happen to say to a person, gee, the van's going to be here tomorrow, you should show up, right? Like it really takes all of us.
It does, and it takes all of us committing, and that's one of the things that has been really successful for us with the van. It's hard, that group that we're targeting, they're not necessarily looking on the internet to look at calendars. They just know that team's going to be there on that day, and our partners commit right alongside with us, just for that consistency. And it's been really helpful. Really helpful.
So what services are available when the mobile unit, the mobile van, we short, we call it the van.
Yeah, exactly.
That's what most people call it.
Yeah.
What services are available within it, and then what do you have to refer back to? Either an exam room that's off location, like the soup kitchen, or with us, or back to the office. What is within it?
So people can come and get a limited physical exam because we don't have a ton of privacy. It's about this, I don't know if you've seen it, it's about the size of an Amazon delivery truck. But they can, get signed up for health insurance. We can start a medical record in the moment. We'll do a health history and take vital signs, do a limited physical exam. So they could get, a diagnosis, they could get treatment in the moment. Then they have access to all our larger services. So even though we're at some of these locations for 2 or 3 hours, they then know that they can call and talk to a nurse 24/7 for advice.
The nurse line, right?
Yes, which is great. And then if they call our main number, if they have a need outside of when the van will be at the location they're going, then the nurse who's answering that call can see what the history was before and just, really answer and address their questions. And then if they want to access behavioral health, we don't do it necessarily from the van, but sometimes we do bring iPads on the van, and we can set them up in a private location, and they can get behavioral health. But we can only fit so many staff on the van.
Right.
And then they can get access to a number of different programs. We could sign them up for, breast and cervical cancer screening at no cost. Our Healthy Lives program, where they can get, labs that would address any, cardiac issue that they might have. And we can really tap them into things that they may have to access at our main health center or maybe not. Mm-hmm. We offer psychiatry through telehealth, behavioral health through telehealth. So sometimes it's just making that linkage, and they can do some of that in their own home, really. Yeah.
We have some resources available for prescription assistance as well. Mm-hmm. So whether you're insured or uninsured, with a couple of local pharmacies. So.
Mm-hmm. And one of the things that really popped into my mind as you were describing all that, Sue, is really just the role of education.
Yes.
Right? Because I think sometimes people, I'm not a healthcare expert, so I have a rash. I don't know, what does it mean, right? Just getting true expert opinion, education, understanding just how sometimes simple that intervention can be, but yet so powerful.
So powerful, because they take that with them. It's a tool that then they have. And it is one of, our off-site programs. We always think of them, the patients who are coming to us tend to have more issues affecting them. So it could be social issues, it could be a substance use problem that they have. It can be that they're not housed. So we have the luxury of spending more time with them. We don't schedule appointments, every 20 minutes, in and out. We really allow for that time to, again, engage with them, relationship build. And we've really seen that pay off, where, we've had patients who really might present almost angry, but it's really like a agitation or a worry about how to access care. They just don't know. And then we'll work with them over time. And then the team that they would see on the van actually works at the main health center. So if we're trying to transition them over, we say, well, I can see you. It's just going to be in a different place, but you'll still see these faces, and it makes people feel more comfortable.
Yeah. And to me, I hear that description and I just think, we see and hear people. We take the time to see and hear people. Like you said, it's not the in, the out, the okay.
Yeah.
Because it's people are more than the foot problem.
Yes. So true.
So true. Well, is there anything we haven't chatted about that we'd hoped we'd get to, or?
I don't think so.
We've covered the programmatic landscape. So.
Yeah. I mean, and I think, for me, the takeaways are, we're here.
Right.
We're open. there's hope, and that you
Yes.
all do so much more than just primary care visits inside an exam room.
We very much want to compliment your organization as well. It's a great
I
partnership.
know.
So.
It has really been a big partnership.
Well, you know, it truly is about a community. And, you know, I think about our vision of an empowered community, our value of empowering people to lead their best lives. And we can't do that alone, right? It takes
Right.
partnerships.
Right.
And a thriving community needs thriving partnerships.
Right.
And so we appreciate you and what you do for the community.
Thank
And
you.
I thank you for coming and just chatting with me about it. I feel like I learned a couple of things,
Yeah.
even though I've been connected to you all for so long. So I appreciate it so much.
Thank you,
you.
Cynthia. It was great.
Awesome. And thank you for watching the Empower Hour with Greater Nashville Mental Health. We wish you an empowered day.